Hello, I'm Dr. Elara Bloom, and today we're going to talk about something every woman will face at some point in her life: menopause. This is a powerful, natural transition, yet for many, it can feel confusing, uncomfortable, and even frightening. My goal? To help you understand what's happening, why it happens, and how we can support your body and mind through it. The average age of menopause is 51, but changes often begin years earlier. That in-between phase is called perimenopause, typically starting 4 to 10 years before your periods fully stop. You officially enter menopause when you haven't had a period for 12 consecutive months. What follows is postmenopause, and the changes don't just stop with your period, they often evolve. One of the earliest signs? Irregular periods. If your cycle starts shifting by more than 7 days, or eventually skips a month entirely, you may be entering perimenopause. But even before that, many women begin to notice hot flashes, mood swings, and sleep disruption. These vasomotor symptoms can last up to a decade. Estrogen receptors are found throughout the body, from the brain to the skin to the bladder. So as estrogen levels drop, many systems respond. That's why symptoms can include hot flashes and night sweats, vaginal dryness or discomfort during sex, insomnia and fatigue anxiety, mood swings or depression, brain fog and memory issues, bone thinning, osteoporosis, urinary urgency or incontinence, joint pain, or even frozen shoulder. Menopause is not just about reproduction, it's a full body event. Short-term symptoms like hot flashes and mood swings often fade, but others, such as vaginal dryness, bone loss, and urinary issues, can become more persistent over time. That's why early support and understanding are so essential. A hot flash is a sudden rush of heat, often starting in your chest or face and spreading quickly. You may feel flushed, anxious, or even notice a pounding heart. Some women feel these several times a day, affecting their sleep, energy, and confidence. Brain fog, memory lapses, feeling not quite like yourself. These are all real. Estrogen plays a key role in regulating neurotransmitters. You're not imagining it, and you're not alone. Menopausal hormone therapy, MHT, is most commonly recommended for hot flashes and night sweats, bone loss prevention, vaginal and urinary discomfort. But if you're struggling with sleep, mood, sexual health, or increased health risks like heart disease or diabetes, it's worth discussing your options. You don't have to suffer in silence. If you've had breast cancer, unexplained vaginal bleeding, blood clots, or severe liver disease, you may need alternative treatments. We'll always tailor your plan to your personal health history. There's a lot of buzz around natural solutions, but many have limited scientific backing. Evening primrose oil, acupuncture, and herbal remedies may provide relief for some, but they won't correct estrogen deficiency. However, mind-body therapies like CBT, mindfulness, and even nerve block treatments show growing promise. Estrogen therapy, transdermal, gels, sprays. Safer for women with clotting risks. Oral pills can benefit cholesterol but affect other hormone pathways. Vaginal rings or local creams. Great for vaginal and bladder symptoms. Progesterone for women with a uterus. Micronized progesterone is bioidentical and generally well tolerated. Some women may experience bloating or mood shifts. IUDs and combination pills may also be options for tailored protection. True bioidentical hormones are FDA approved and available at your local pharmacy. You don't need to rely on custom compounded versions unless there's a specific need. Older studies, like the Women's Health Initiative, raised concerns, but used outdated hormone types and included older, higher-risk women. Modern therapies are safer, smarter, and better targeted. For many women, the benefits clearly outweigh the risks. Menopause doesn't have to feel like an unraveling. With the right knowledge, support, and treatment options, you can feel like yourself again. Every woman's journey is different, and there is no one-size-fits-all solution. Your health, your hormones, your voice, heard. Subscribe for weekly insights, Q&As, and expert breakdowns on everything from HRT to libido to sleep. You deserve to thrive in every stage of womanhood.